So welcome everybody. Hello again. We're back with some more See Big Screen information, and today we have the great pleasure of welcoming Rikke Boje. I hope I got that right. She is a postdoc at the University Research Clinic for Cancer Screening at the Department of Public Health Programs at the Regionshospitalet Randers in Denmark. My Danish pronunciation is not very good. Rikke, thank you so much for taking your time to be here today to talk about the collaborative user boards, or COBs as we generally refer to them. So can you tell me a bit about the Danish COBs and just kind of how they went and what the experience was like?
Yeah, thank you. And thank you for giving me the opportunity to tell you a little bit more about the COBs in Denmark in particular, but I would like to take the opportunity to actually explain a little bit more about what a COB is and why we're talking about COBs. Because in our University Research Clinic, we have the responsibility for developing and designing this part of the study. And we have now established COBs in 7 different countries within the See Big Screen project. And we have prepared and supported the COB facilitators in the other countries throughout the process, the very excellent facilitators that we have in the other countries. And so the main idea with these COBs is to bring people together, stakeholders, different types of stakeholders engaged in cervical cancer screening or engaged in the work with vulnerable women, to bring these people together, first of all, to learn about their perspectives, to explore their perspectives on barriers and possibly new ideas and solutions to how to increase the uptake in cervical cancer screening among vulnerable women. But also for this group of participants to learn from each other and for us to gain some insights based on this learning process that they can provide to each other. The idea was to target subgroups of vulnerable women, to have representatives from these subgroups, but also healthcare workers, social workers, NGO workers, and also policymakers and decision makers, to include all these different types of actors in the COBs. Yeah, so that's sort of the main idea with the COBs. And I would also like to tell you, before I tell you about how it went with the COBs in Denmark, I would like to tell you a little bit about the recruitment process, because that was sort of a delicate process, and also provided us with some insights in how to reach these hard to reach groups. One of the reasons that it was a delicate process was that these women, they do not necessarily have confidence in a person like me, because in their eyes I represent the system. So in order to get to the hard to reach groups, I had to actually find someone that they felt confident about and safe about. And in Denmark, I approached a street nurse. First, I approached this street nurse, and immediately she started to think about who could be a good representative in this case. And she pointed out several women that she wanted to approach. I actually never approached the women myself. They were approached through this street nurse, and in other cases through an NGO worker, and in another case it was the head of a shelter who actually approached the women. And these people, they became very key to the whole recruitment process, because they also provided us with their large networks of other healthcare workers, social workers, and so forth, and also policymakers actually, and decision makers. So they became very key in order to make this recruitment process go smooth. And it took quite a lot of time to get the whole group together. In Denmark, we established 2 COBs, one in a bigger city and one in a smaller town. So we had to recruit people for both cups. And yeah, what else can I say? We included, in our cups, we included street nurses, we included social nurses, and we included general practitioners, gynecologists, decision makers from the municipality, and also local politicians.
Oh, wow, okay.
Yeah, and furthermore, they were actually very interested in participating. And furthermore, we of course we included representatives of sex workers and substance abusers, because these were the vulnerable groups that we wanted to target in Denmark. And so how did it go with our cups? It went quite well, but we did have some challenges, because we also found out that the recruitment process, that it's not necessarily a good idea to approach the vulnerable women long time in advance, because they tend to live from day to day. So it's difficult for them to make long-term plans. And in research, we do make long-term plans, and yes. Also actually to include the policy makers and the decision makers, that had to be long time in advance in order to fit into their busy schedules. But the women, and it turned out as well that in one of the cups, only one of the women showed up. And that was despite that I had been meeting up with the women. I called them in their homes and asked them to meet me in the drop-in center where they usually hang out. And I went there to prepare them and to explain about their role as representatives, and also for them to gain some confidence in me. Of course, despite these efforts, just one woman showed up on the day of the collaborative user board meeting in one of the cups. Yeah. And well, the healthcare workers and so forth, they said, but this is actually one of the barriers, that they do live from day to day, and this is just another day at the office. This is so usual for us when we have appointments with these women. So that's one thing to take into consideration when you want to plan and improve the uptake. In both cups, in order to stimulate or to motivate the discussion between the participants, we used recorded interviews with other vulnerable women, and where I have been interviewing women to learn about their perspectives on barriers and solutions to cervical cancer screening. And that's actually served as a very strong motivator for the, especially the women represented in the cups, because they felt that they could they had the similar experiences as these women talking, and that engaged them very much in the discussions. So all in all, the cups were so far a success, because they provided us with a lot of perspectives and insights concerning barriers towards cervical cancer screening. And currently we're planning for the next cup to take place. This is going to happen in June, where we will discuss new ideas and solutions. So yeah, that's where we currently are.
Okay, that's great. Thanks so much. That's really interesting to hear, and it gives like a really good insight into, all the work that goes, before something like this. And what do you think some of the barriers were? I mean, you described it very well there, kind of how, you engaged with the women, and then, even so they didn't show up. And, what do you think some of the barriers might be to kind of this just reluctance to attend the Cubs?
Well, some of the things that the women, they mentioned was that, for instance, in Denmark, when you have to have a cancer screening, cervical cancer screening, you have to go to your gynecologist or to the general practitioner. And one of the things that they mentioned was that sitting in the waiting room could be sort of a challenge, because they've already at that point, they felt different from the rest of the people sitting in the waiting room. They would also say something about that they were afraid that they would be dirty, that they would smell, and very, you know, practical things like that. And also the sex workers mentioned that it is actually a big challenge because they don't want anyone to come near that area anymore.
Of course.
That would be too intimidating for them. So these are just a few of the barriers that the women talked about.
No, that's really interesting, and just, you know, plenty of food for thought, and like you say, for you know, for future discussion as well. It's just very useful to have the you know, the insight into that.
Yeah, because we might think that it's other types of challenges. Of course, we know some of these challenges that they mentioned already from the literature, but it's important to get exactly their perspectives on this. Yeah. Absolutely. And also for the other actors to actually engage and hear about this, because this will also impact their thinking of how to solve the challenges that we have and how to improve this.
Of course. No, that's we look forward to hearing more about it. So hopefully we'll get another update. So maybe sometime during the summer to see how things are going. So just want to say thank you so much again, Rikke, for coming and talking. It's just very interesting to hear from the different countries, you know, how it goes ahead, and you know what these barriers are. It really gives insight into what the project is trying to achieve. So thank you so much for being here, and we'll talk to you soon again. Thanks so much.
Thank you.